Welcome to the recorded version of Managing Arthritis in Older Adults, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Okay, we got two presenters joining us here today. Lakeland Hogan is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. Also joining us today is Nick Turkas, who is the Director of Help and Support at the Arthritis Foundation. Nick has served the Arthritis Foundation at the local, regional, and national level for more than 19 years. As the Director of Help and Support, he is responsible for overseeing the development and expansion of personalized consumer resources that empower people to live better with a higher quality of life and less pain. He manages the Arthritis Foundation's helpline, Arthritis Foundation Knowledge Base, the evaluation of third-party fitness and health resources, and expansion of the Arthritis Foundation Resource Finder. In addition, he manages the Living Your Yes with RA community education programs. And with that, I'd like to welcome our two presenters here, Lakeland and Nick. Thanks for being here.
Thanks so much, Steve. Hello, everyone. I hope that your day is off to a great start. I want to thank you so much for joining Nick and I today as we talk about a really important topic. Each month we cover some senior-related, caregiver-related topic and give professionals tips, tools, and resources that they can then pass along to the individuals that they're working with, whether it be the older adult themselves or the family caregivers that are caring for an aging loved one. And today we're going to be talking about arthritis, and we're going to provide you with some resources all about living at home with arthritis and hopefully give you a few nuggets of information to take away to make life easier for those living at home and helping them cope with those various challenges that arthritis can present. And I'm really excited to have Nick Turkas from the Arthritis Foundation joining us today. Home Instead has partnered with the Arthritis Foundation in various ways over the years, and they're really truly the expert when it comes to everything arthritis. And so you're going to be hearing from Nick in a little bit, and I do believe that May is Arthritis Awareness Month. So this webinar falls at the perfect time to bring more awareness to all of the people across the U.S. that are living with arthritis, and I'm going to share those numbers with you all in just a little bit. So before we get started, I thought I would do a quick overview of what arthritis is. So we know that the word arthritis is kind of an overarching term that refers to more than 100 different diseases that cause pain, swelling, and limited movements in joints or other parts of the musculoskeletal system. Many forms of arthritis are chronic, meaning that they can last for a lifetime. The limitations caused by arthritis can impact a person's quality of life, and as a result, can also impact the family caregiver's life and the way they go about their caregiving. Unfortunately, there is no cure at this point for arthritis, but there are ways that people can manage the pain and symptoms, and in a bit, Nick will share more on that. And before I talk about the prevalence, I want to make sure that we all understand that arthritis is not a normal part of aging. While it is common, it is not a normal part of aging. So family caregivers and older adults should not ignore the symptoms and think that there is nothing that can be done, because that's simply not true. As you can see on the screen in the photo, there are some visual indicators of arthritis, but oftentimes non-visual symptoms present first before any visual signs of arthritis. So we need family caregivers to take those symptoms seriously and encourage their loved one to get to their medical provider for further evaluation, because as Nick will talk about, there are ways that medications and other ways that we can manage the pain and symptoms that can make the quality of life better for an individual living with arthritis. So now on to the prevalence. Here in America, 54 million adults have a doctor-diagnosed arthritis, and really that number is likely conservative. Some people might not be reporting their arthritis pain and symptoms. And by 2040, the number of people with arthritis is estimated to grow to 78 million people. So we know that this is definitely a disease that is prevalent, especially among older adults. And we do find that doctor-diagnosed arthritis is more common in women than men, and arthritis and other non-traumatic joint disorders are among the 5 most costly conditions for those 18 and older in the U.S. In 2013, the total medical cost and earning losses due to arthritis were estimated at about $304 billion. So this can be a costly disease. And clearly this condition, as professionals, this condition is something that will likely come across often and is an issue that family caregivers will be dealing with. So we want to be able to, again, to equip them with resources and tools to make daily life easier, improve the quality of life. So I'm going to quickly go over our objectives today now that we have a good baseline for what arthritis is. So we're going to start off by talking about the symptoms and the warning signs of arthritis, and Nick's going to cover that for us. And then we're going to talk about some tips for preventing arthritis, which is not only beneficial for older adults, but also for family caregivers. And then we're going to be talking about tips to make lives easier living with arthritis, and then also some tools and resources that the Arthritis Foundation has to help with arthritis management. And they have so many great resources, so I'm really excited to share that with you all towards the end of today's webinar. So let's first start by talking about the various types of arthritis. So when we work with families, they can sometimes get confused about what arthritis is. They might not realize that there are different types of arthritis. So the way I like to explain arthritis is that arthritis is kind of a general term for the chronic condition of arthritis that causes damage to the cartilage and joints. And if you think about it as kind of an umbrella, so arthritis is the umbrella, and underneath arthritis are the various types. And this is similar to the way I like to describe dementia. So dementia is kind of the overarching term, and then there's different types of dementia like Alzheimer's disease, Lewy body, that sort of thing. So we can kind of think of arthritis in the same mindset. Again, it's that overarching term, and there are various types of arthritis underneath that umbrella. Some of the most common ones are ones we're going to be going over today. So in this webinar, I'm really going to focus in on 2 forms of arthritis that are most common among older adults, and that's osteoarthritis and rheumatoid arthritis. And I'm going to dive into those 2 here in the coming slides. But we do know there's a few other types that are listed here on the screen. So there's osteoarthritis. It's a degenerative type of arthritis which develops over time, and I'll go into that more here in just a little bit. And then there are other common types of arthritis that are more autoimmune or inflammatory. And these types of arthritis, what's happening in the body is that the immune system can go awry and mistakenly attack the joints with uncontrolled inflammation. So it can potentially cause joint erosion. It might damage internal organs, eyes, other parts of the body, and it's believed to be a combination of genetics and environmental factors that can trigger some of these types of arthritis. And as I mentioned, rheumatoid arthritis is one of the most common types of inflammatory arthritis that we find in the older adult population. And I'm going to go into more detail on that type in just a moment. But we know that there's also psoriatic arthritis that can be experienced by some older adults. This is a form of arthritis that can occur in conjunction with psoriasis, which is a skin scaling disease. And about 30% of people with psoriasis develop psoriatic arthritis. So if you're working with an older adult who does have psoriasis, this is something that you want to keep your eye out for, is any arthritic symptoms along with that psoriasis diagnosis. And in this type of arthritis, psoriatic arthritis, it causes inflammation that triggers joint pain and stiffness and might cause permanent damage if it's not treated early and aggressively. And then we have gout, and gout is a form of metabolic inflammatory arthritis. It's not necessarily an autoimmune, but it develops in some people who have high levels of uric acid in the blood. And this uric acid can form needle-like crystals in a joint and cause sudden and severe episodes of things like pain, tenderness, redness or warmth, swelling, and even cause some overall loss of appetite. And the pain could last hours or weeks, and it really can make it difficult to perform those activities of daily living. And gout is often related to the types and the amounts of food that we eat and how our body is able to metabolize or process those foods. So rich foods and rich drinks can contribute to the development of gout, but the real cause is how the body is breaking down the purines into that uric acid. And then we have lupus. So this is an autoimmune disease in which the immune system overreacts. So lupus is systematic, which means that it can affect many parts of the body, and it's not just limited to the joints. It can also impact other organs, such as the skin, kidney, lungs, heart, and the various blood vessels, and even impact the brain. So again, there are probably, as I mentioned, there's over 100 types of arthritis. So this is kind of the tip of the iceberg. But I really do want to hone in on the two most common types of arthritis that we see in the older adult population, starting with osteoarthritis. So osteoarthritis is a degenerative disease that's characterized by the breakdown of joint cartilage. It's really kind of the wear and tear arthritis. This is the most common form of arthritis that impacts nearly 30 million Americans, most of them over the age of 45. So in normal joints, the cartilage, which is a firm rubbery material that covers the end of each of our bones, in osteoarthritis, this cartilage can break down. So typically in healthy cartilage, it provides a smooth gliding surface for joints to move around, and it really acts as a cushion between the bones. So again, in osteoarthritis, that cartilage breaks down, which causes pain, swelling, and problems with moving that joint. And usually it develops slowly and worsens over time, but it can also develop after an injury or trauma, such as a sport injury, car injury, and so forth. Also, some people are at a higher risk genetically, and others might be at risk due to obesity or other metabolic factors. So when we look at osteoarthritis symptoms, it really can range from mild to severe. So some might require a hip and knee replacement. That's really becoming more common for more of the end-stage osteoarthritis. Actually, 2 women in my own family and even my uncle, so several people in my family have had hip replacements over the last couple of years. So my family has a heightened awareness to this type of arthritis, but usually the joints are affected by osteoarthritis ache and become painful, especially first thing in the morning or during or after extended use. And osteoarthritis can really occur in any joint, but most frequently occurs in hands and then those weight-bearing joints that we rely on to help get us around, such as our hip, knees, and then also it can impact our spinal joints. These joints may be stiff also after periods of inactivity. So sometimes they can be irritated after extended use, but also they can become stiff if we aren't being active and moving them. So it really is important for people with osteoarthritis to remain physically active despite any initial discomfort they might feel. That exercise really keeps the joints moving and helps them stay lubricated. And it also can help build strength in the muscles that surround the joints and affect the joints so those muscles can better support it. So we'll be discussing the importance of physical activity later on in the webinar, but I do now want to turn to rheumatoid arthritis because that's the other most common type of arthritis that we see in older adults. And sometimes you'll hear it referred to as RA, the abbreviation of rheumatoid arthritis. And in the U.S., about 1.3 million people have RA. And I mentioned earlier that this is an autoimmune disease in which the body's immune system can mistakenly attack the joints, which can create inflammation and cause the tissue that lines the inside of the joints to thicken. So that results in swelling and pain both in and around the joints. And this is a systemic disease, meaning that it can affect the entire body and is characterized by the inflammation, again, of that membrane lining of the joints, which can cause pain, stiffness, warmth, redness, swelling, that sort of thing. And RA most commonly affects, the hands, feet, wrists, elbows, knees, and ankles, and is also, it's often symmetrical, meaning it affects both sides of the body. So, for instance, if you have it in one hand, you're likely to have it somewhere else on the other hand or on the other side of the body. And in more severe cases, rheumatoid arthritis can affect other areas of the body, such as skin, eyes, lung, the mouth, and nerves. And with RA, the person's joints, the ones that are experiencing the pain, often are warm to the touch. And you might also notice a decrease in the range of motion, an increase in inflammation, swelling, and pain in and around those joints. And because the inflammation is systemic, a person with RA is likely to feel fatigued. They might become anemic. They might lose their appetite. They could even run a low-grade fever. So when we think about older adults, if they haven't had a diagnosis of any type of arthritis and they're exhibiting some of these symptoms, it's really important that we're getting them to a medical professional. So based on what I've talked about regarding rheumatoid arthritis, you can see that it could be challenging for a person who has RA to move about their environment, to engage in their activities of daily living, which might require them to rely more heavily on a family caregiver. So this is, again, one that a lot of family caregivers might be dealing with in one way or another. And then there are some other related conditions that are often associated with arthritis or talked about in conjunction with arthritis. Pardon me. So the first related condition is fibromyalgia, and really this affects about 3.7 million Americans. And this is a condition that's associated with widespread amplified chronic pain, which is experienced in different parts of the body at different times. And this, along with other symptoms, strongly impact the quality of life for these individuals. It's not necessarily a single disease, but it's more of a combination of symptoms that can be managed. This is not a form of arthritis because it does not necessarily inflame or damage joints, but it can be considered an arthritis-related condition. It's often comorbid with people who have different forms of arthritis, meaning they might have rheumatoid arthritis and fibromyalgia or osteoarthritis and fibromyalgia. And it can present differently in different people. And then speaking of comorbidities, it is common for people living with arthritis to have other chronic conditions. So if you look on the slide, about 49% of older adults with arthritis also have heart disease. 47% also have diabetes. And if you think about, how you manage certain chronic conditions such as diabetes, injecting insulin might be very challenging for somebody who has limited dexterity or use of their hand due to arthritis. So might need to work with the medical provider to see if there is an alternative like an insulin pump as opposed to regular injections if the mobility in their hand is limited due to their arthritis. And then 31% of older adults who are obese also have arthritis. And if you think about that, we talked earlier about those weight-bearing joints, those hip, knees. If there's added weight, it can be causing added stress. And so you can see how for an individual who's obese or overweight, they might have issues with arthritis due to that added weight put on those joints. Then we also see, unfortunately, that depression is common with common comorbidity of arthritis. So we really have to be aware of that and make sure that the medical professional is aware of any depression symptoms that the individual might be exhibiting, because it very well could be treatable, and it might also be depression due to some sort of limitation that we could find a creative solution for. So in a little bit, we'll be talking about those creative solutions, but we'll get to that here in just a few slides. So when a person has comorbidities, family caregivers really need to help communicate with medical professionals and advocate for the older adult to make sure that treatments for the various conditions are being addressed and that healthcare providers are updated on regular changes that occur. We know oftentimes older adults are seeing multiple doctors, a rheumatologist, maybe if they have heart disease, a cardiologist. So want to make sure that there's good communication and that all treatments are being discussed among doctors to make sure that there's no adverse treatments or anything that would compromise one condition or the other. So I've been talking a lot about the arthritis itself, but it's really important to seek a diagnosis of arthritis. So I'm going to turn it over to Nick so he can talk more about the importance of that arthritis diagnosis.
Thank you so much, Lakeland. It is important to remember that arthritis refers to more than 100 diseases that cause pain, swelling, and limited movement in joints and other parts of the musculoskeletal system. And the key to successful treatment is early diagnosis and the implementation of an appropriate treatment plan. And so one of the key factors people should be aware of in determining when they should seek medical treatment is swelling or stiffness in joints that last for more than 2 weeks. So this is really important to share with family and caregivers that they can keep a journal or track symptoms. In fact, I'll share our Better Living Toolkit that has a health tracker that's approved by many healthcare providers that can help you track symptoms over time. And that can really help you provide a more complete picture for the healthcare professional. And a symptoms journal kept over several weeks can really help track the most important facts about the condition and then track changes that may occur. Two things I'd note are, one, getting that diagnosis is so key. It's shocking to me the number of people I talk to that tell me they have arthritis. And I say, well, what type of arthritis do you have? And they jokingly say, the kind that hurts, the kind that's in my knees. Or sometimes people will say, I have osteo. And I say, oh, osteoarthritis or osteoporosis. And they smile shyly. There's a lot of people that don't know what type of arthritis they have, and if you don't know what you have, you really can't treat it well. And the other thing about that tracking of your symptoms, it's so important. Many people who come before a healthcare professional get nervous and they get a little of amnesia. The doctor will typically ask them how they've been feeling, and people will talk about how they've been feeling that morning or maybe the last couple of days, but they're not typically able to give a good picture of how their pain and stiffness have ebbed and flow over maybe the last couple of weeks or couple of months. So tracking those symptoms with a health journal or the health tracker is really, really important. So if we're looking at pain and this pain is consistent, then we definitely should make an appointment with our primary healthcare provider. That's definitely the first step. Physicians will diagnose arthritis using various tools and diagnostics. They can do an overall review of the symptoms, medical history, a physical examination, well, they'll look at the joints and touch the joints, imaging studies such as X-ray or sometimes MRI, and in some cases like osteoporosis, bone scan or DEXA scan. They also may do some laboratory tests. For rheumatoid arthritis, typically blood tests are done. A doctor may also order what is called a sedimentation rate or C rate. This test is an indication of the presence of nonspecific inflammation in a person's body. SED rate is a C-reactive protein test or CRP, and as noted above, the doctor may also order X-rays or of the patient's patient's bones and joints, and it also, in some cases, may require an MRI, which can give more precise information about the bones and joints as well. What's important to know is that in X-ray, cartilage is invisible, so doctors will typically look at the narrowing of the joint space as an indicator of osteoarthritis or other forms of arthritis. Once the tests are complete, the primary care practitioner may refer the doctor to a specialist. That's typically a rheumatologist. Again, rheumatologists are arthritis specialists, especially for inflammatory arthritis or autoimmune arthritis like rheumatoid arthritis. It's really important that they're diagnosed and treated by a rheumatologist. And we also have orthopedic surgeons, and those are professionals that can perform surgical procedures such as a joint replacement. Other important allied health care professionals may include an occupational therapist. We're going to show some cool tools, and occupational therapists are definitely the wizards when it comes to determining different ways of doing activities and also different sorts of durable medical equipment and aids to complete activities of daily living. And then we also have physical therapists, so important for helping restore function and prevent disability. They can teach people how to gain function, strengthening, and flexibility back in their joints. So that can be important before surgery, after surgery, or to avoid surgery. And so after diagnosis, many people inquire about treatment options. So once we know what we have, we need to treat it. So we're going to talk more about those treatment options now. So, as I've mentioned before, pain is probably the most common symptom for arthritis and related conditions. So most of these medications will, at least in some way, help ease pain. And easing that pain is a primary goal of medical treatment. The most common first line of defense are over-the-counter aspirin and other non-steroidal anti-inflammatory drugs, which are known as NSAIDs. That's NSAIDs. And these drugs have an immediate pain relief and anti-inflammatory effects that are relatively safe. Although, like any drug, they can have side effects and can interact with over-the-counter prescription drugs and prescription drugs, and so their long-term use should always be discussed with a physician. So if someone is taking over-the-counter medications to control pain, they definitely need to bring that up with their healthcare provider, and if they start or stop taking it, it's often a good idea to let their healthcare provider know and why. And it's also really important to know for caregivers that they should check with those doctors. Just because you can buy it over the counter does not mean that it's safe, especially among older adults who may have comorbidities. And also, and at what dose? There are can be people that can take too many. If one is good, 2 is great, and 4 or 5 maybe would help even more, but that's not a good strategy. We should always consult the bottle and the physician to make sure that we do not overdose on over-the-counter prescription medication. Tylenol can be particularly dangerous if you overdose on it. So there are definitely some of those big warnings for NSAIDs for older people. They can raise the risk of heart attack and stroke and GI bleeding too, and they shouldn't be given to people with certain existing heart conditions. Again, check with doctor. Because of the prevalence of arthritis, many prescription drugs have also been developed. For biologics, you may have seen some TV commercials for biologics. I seem to see them all the time. Are the most recent breakthrough in treatment for rheumatoid arthritis. Biologics are genetically engineered proteins derived from human genes, and they're designed to inhibit specific components of the immune system that play a pivotal role in fueling inflammation. So we know in rheumatoid arthritis that immune system is attacking our body's tissues, and these drugs actually help tamp that down, which is very important. Biologics are infused in a doctor's office or injected at home. These drugs have been found to dramatically improve the quality of life for people with rheumatoid arthritis. So again, if it's important to get an early diagnosis, especially if it's rheumatoid arthritis, working with that rheumatologist, and if we found that many people that can find a treatment, including a medication, with these options, biologics in particular, can significantly reduce the joint damage that can occur and significantly reduce that damage and disability and deformity that can occur because of rheumatoid arthritis. Other drugs, including corticosteroids, are a class that can suppress the immune system. They're like the fire hose of anti-inflammatory medication that can really put out the fire of hot, warm inflammation. They're sometimes used to inject in osteoarthritic joints, and they may be used to treat autoimmune forms of arthritis. However, like NSAIDs, many have side effects, and so doctors don't like to have patients on them for very long. So it's also important to never stop a corticosteroid cold turkey. People typically need to be tapered off. So again, follow your doctor's directions on that. Another drug sometimes injected into joints is hyaluronic acid, sometimes called viscosupplementation. These injectables are not really surgical options. They're essentially a lube job for your joints is one way of thinking about it. You know, you have a viscous liquid in your joints, in your joints. You don't have blood there, and this artificial fluid can help with moisturizing your cartilage and lubricating it. Some people do really well with it, and some people don't have much of an effect. It really depends on the person, and so it's always best to talk with our doctor about it. These, again, are not permanent helping solutions. They typically will last a few weeks to a few months. And other treatments, good old heat pack and cold pack, bag of peas, frozen peas. You can make a heating pad out of a sock and a cup of rice, put that in the microwave, and it will warm up and get toasty. That's something that you definitely try. There are certainly alternative therapies such as acupuncture, meditation, prayer, aromatherapy, herbal remedies, and supplements that can be helpful, but it's always important to consult your physician before trying any sort of alternative therapies. And there are also some surgical options. Option A would be to inject the joint with that joint fluid, that viscosupplementation, that hyaluronic acid. And there's also joint replacement surgery to replace the affected joint. And both of these treatments can definitely help with the quality of life of people living with arthritis. Many people suffering from arthritis find that lifestyle changes can also be very important, can definitely improve symptoms from osteoarthritis and other long-term types of arthritis. And so Lakeland is going to talk to you about some lifestyle tips.
Thank you so much, Nick, for going over the diagnosis process and the importance of a diagnosis and then the treatment options that are out there. And just as you mentioned, lifestyle changes can be a way to help manage arthritis at home. And so I'm going to start by going over some of those lifestyle changes and adaptations that older adults can make with the help of caregivers and other family members to hopefully help make quality of life better with arthritis. So once a person has a diagnosis, there really are a number of things that they can do to, again, manage arthritis and improve their quality of life. And one of the best ways for all of us to protect our joints is to maintain a healthy weight and lose weight if needed. Even a small reduction can help. So again, if somebody has excess weight, it puts more stress on those joints that are more susceptible to arthritis, those hip, knees, back, and feet. So that is important. And we'll talk about nutrition in just a little bit. So also important is exercise, a regular exercise routine. We've talked about that a little bit already, but research does show even a limited amount of exercise can help prevent some of the negative effects of arthritis by strengthening muscles, supporting those painful or damaged joints. And then also eating a well-balanced diet can be helpful. And again, we're going to talk more about nutrition in just a little bit. But it's also important to move regularly. If we're sitting too long or static for long periods of time, if we have arthritis and not moving around enough, it can cause stiffness. So we don't want the older adults with arthritis to be static, wanting them to get up and move frequently, which can hopefully help prevent that stiffness. And then it's also important to manage the pain, especially as prescribed by the doctor. I work with many older adults who will use the medication and they start to feel great, and because they're feeling great, they stop taking the medication, and then it goes back to hurting again. And that's because they aren't sticking to the medication regimen and managing the pain over a long period of time. So it's really important to discuss with the medical provider about the prescriptions that have been prescribed for arthritis, and asking questions about the treatment plan, and if you're considering changing the treatment plan or no longer continuing the medication, it's really important that they check back with their physician or medical professional first before doing so. So I mentioned the importance of physical activity. I want to dive into that just a little more deeply. So we know that physical activity can reduce pain and improve physical health, and really family caregivers can help to encourage their loved one to engage in some sort of regular exercise. It could be alone or in a group setting. And Nick is going to share some great resources later that the Arthritis Foundation has to help encourage exercise. But really, there are various types of exercise. There's range of motion or flexibility, aerobic, endurance, strength training, walking, and even water aerobics, water therapy can be a great way to exercise. So if the older adult has not exercised or is not currently exercising, it's important to consult the physician before getting up and moving about and starting that exercise routine. But even just getting up and moving about the house throughout the day on a regular basis can go a long way in preventing that stiffness. All right, and then nutrition. We talked a little bit about eating a well-balanced diet is good for us all, but especially with arthritis, it can help possibly help to reduce body mass, can help us maintain a healthy weight, and there are some anti-inflammatory diets that could have a positive impact or help with some of the management of symptoms. And one of the popular ones is the Mediterranean diet. This diet is low in processed foods and saturated fats, but is rich in fruits and vegetables and nuts and beans. We also find the Mediterranean diet is good for cognition. So this type of diet is good for a lot of different things. But nutrition impacts people differently on an individual basis, and some persons' arthritis might be impacted by what they eat, and some in terms of causing inflammation or helping to fight inflammation. And so it's really important to track, maybe keep a food journal, track the foods and their relation to pain levels to see if there are any patterns as it relates to what they're eating. I know for some individuals, eating gluten or drinking alcohol, those types of things cause inflammation in their body, while others, it doesn't impact them at all. So again, keeping track of what you're eating can be helpful, especially if you also are tracking the level of pain and discomfort. So, and again, we mentioned several times already, but reducing body weight if needed, and of course consulting your physician about options for weight loss. And then not only is it important to talk about what to do after you've been diagnosed with arthritis, but there's a lot we can do in terms of prevention and risk reduction, especially for family caregivers. We know that family caregivers are a lot of times under physical stress and strain, emotional stress and strain. So taking care of themselves too and preventing possible joint damage or injury can go a long way. So first, one of the ways to reduce the risk of arthritis is to maintain that joint mobility and functionality. A great way to do this is through exercise and moving around regularly. and also avoiding injury. I have a family member who had a skiing accident in her 30s that led to an eventual hip replacement in her 50s due to the arthritis that developed as a result of injuries. So avoiding those injuries throughout your lifetime can, of course, be key as well. And then there are modifiable risk factors for the various types of arthritis. So for osteoarthritis, helping to maintain a healthy body weight. For rheumatoid arthritis, smoking can be a risk factor. So choosing not to smoke or quitting can be helpful in reducing the risk. And then for gout, maintaining a healthy, well-balanced diet can be important in that prevention or risk reduction side of things. So now I want to turn to more of those practical tips for family caregivers and for you as professionals as you're working alongside older adults and their family caregivers. So the first kind of seems like a no-brainer, but listening and being empathetic to the older adult can be very important, especially if the individual does not have a diagnosis and they are expressing symptoms. We want to be sure caregivers are taking their concerns seriously and making sure that they get to their medical professional and helping them, as Nick mentioned earlier, track some of those symptoms so that when they go to the physician, they can give a more accurate account of the symptoms and how it is impacting their everyday life. Also, caregivers can encourage movement throughout the day, encourage engaging in an exercise program or those simple movement activities, getting up and walking around the house, walking around the block if it's nice outside, even some stretching exercises. Caregivers can really initiate that with their loved one. And then they can look into occupational therapists. Occupational therapists, as Nick mentioned, have a lot of ideas and tricks and tools to help an older adult remain independent and keep as much of the functionality as possible. This could come at a cost to the family, but the investment might be worth it in the long run, especially if it improves the quality of life. And then the caregivers, as I mentioned earlier, can be the advocate and help communicate amongst their loved ones' healthcare providers. They can help keep that journal of symptoms, and they can also focus on the positives. Oftentimes, we get caught up in so much of the negative, I can't do this anymore, or my arthritis limits me in this capacity, but we need to help them focus on what they still can do and then help them find creative solutions for those challenges. And I'm excited to share with you some practical tips for daily living on the next couple of slides. So we know it's important for older adults to be able to maintain their ability to perform their activities of daily living, to go about their daily routine with independence. And so there are many products on the market today that can really help improve the life of people with arthritis, and there's some tips and tools, especially for some of the common areas that pose challenges, the first being the kitchen. I recently talked to an assistive technology professional. That's kind of an up-and-coming profession, assistive technology. And she shared some great tools and resources. Some are marketed towards those living with arthritis, and some are just some handy tools you can find on Amazon or at Bed Bath & Beyond that can really make life easy. So as you can see on the top right of the screen, that tomato on the cutting board, that's a special cutting board that's adapted for those who need a little more assistance holding the vegetable or the piece of food in place while they cut. Also, an automatic dispenser for soap can help make washing dishes easier. And then that little I'm not quite sure the exact name of it, but the knife that you can hold on to, and it kind of looks like a seesaw. It's cutting celery right there. That can really go a long way in helping to maintain independence. This assistive technology professional, she shared a story of a gentleman who didn't want to go out to eat with his wife anymore because she had to cut his food, and that was embarrassing to him in public. And so she helped him find that tool that you see on the screen there, and they can now go out to eat together, and he's able to bring that tool along and cut his own food. There's also tools with handles and foam for better grip. There are pieces of technology or assistive technology out there, or even some household items that have a rubber bottom to hold a bowl in place while you stir, electric can openers. The ones on the bottom left, so that saucepan, there's a two-pronged device that helps stabilize the pan in place so it doesn't move around while you stir. And then that pot of water with the strainer, this is, I think, such an ingenious idea. I might even start using it at home. It's just strainers that were originally designed for portion control, but you put the pasta or whatever you're boiling into the strainer, and then all you have to do is lift that out so that the older adult is not, or the person with arthritis is not having to carry the scalding hot pan over to the sink to drain the water. So even little things like that can really go a long way in helping maintain independence. And then if we go to the bathroom, that's another area of the house that, those activities of daily living that take place there are really important. So installing grab bars, toilet seat risers, automatic dispensers, and pumps for grooming products can be really, really helpful. If you've ever tried to squeeze a bottle, it uses a lot of strength at times, especially when it gets down to the bottom of the product. So having the pump or an automatic dispenser can really be helpful. On the last slide, I forgot to also mention crock pots are a great tool that you can use in the kitchen that doesn't require a lot of stirring or mixing. You can make great meals in that crock pot. Forgot to mention that. But back to the bathroom. As you can see on the right-hand side, there are a number of grooming products that can also help, brushes with adaptive handles, a loofah with a long stick on the end so you can reach your back and you don't have to bend and move around as much. You can also replace buttons or snaps with Velcro. There are sock aids and long-handled shoe horns. There's also devices that can help clip toenails or stabilize your hair dryer while you blow dry your hair so that you're not having, again, to overuse those joints that might already be inflamed. And then some additional tips around medication management. There's a lot of new inventions in this realm. There are upside down caps, and most caps on pill bottles, actually you can do this with just about any of them. You can just flip that cap upside down, or those pill poppers for over-the-counter medications that come in those pesky foil, as you can see on the screen there. And then there's easy-to-open prepackaged medication systems such as Simple Meds that eliminates the need for that MediSet prepackages the medication. That way you only have to rip off what you need. You don't have to deal with those pill bottles, that sort of thing. And then when we think about recreation, that's still an important part of daily life. So there are card game holders. You can put grips on tools such as paintbrushes. I thought that was a genius idea. Just slipping a tennis ball onto a paintbrush can really help someone maintain that activity, adaptive gardening tools, and so forth. So there are a lot of creative ideas out there. A lot of times you can Google arthritis-friendly tools. I know the Arthritis Foundation also has some great resources that can help you find these things. And so I'm going to turn it over to Nick to go over all the various tools and resources that the Arthritis Foundation has. So Nick, I'll let you take it from here.
Thank you so much. I am so excited to talk about some of the Arthritis Foundation's tools and resources to make people's lives a whole lot easier. And please know that what I'm going to share is just the tip of the iceberg. The Arthritis Foundation has a lot of great tools. And actually, if you go to our website, arthritis.org, and you'll see on the slide there are headers at the top. There's About Arthritis on the far left, and the second heading is Living with Arthritis. And so that clicking on Living with Arthritis, that's my world. This is all of the great tools and resources that the Arthritis Foundation has to offer. I highly encourage you to check that out. All of those great tools and resources can be so, so helpful. But I do want to highlight a couple of those things right now. First up is our helpline. So for many people with arthritis, they really struggle with healthcare provider communication. They struggle with dealing with insurance barriers, financial problems, and the Arthritis Foundation's helpline has licensed clinical social workers that can provide a clear path to the next best steps to take when dealing with arthritis and financial issues. And so this team is really versed when it comes to overcoming some of these very common barriers, and you're going to get person-to-person support. You can call in at that 1-844-571-HELP, or if you're more comfortable emailing, you can email helpline@arthritis.org, again, for personal help with your arthritis problems. We also have our Live Yes Connect groups. Our Live Yes Connect groups are essentially support groups that meet throughout the country, and it's really important for people with arthritis to be with peers, to be with people that understand what it's like to deal with arthritis. As you can see, our groups are open to adults of all ages, and what's great is that all of the facilitators of our Live Yes Connect groups are trained by the Arthritis Foundation, but typically each support group members and their facilitators help choose the topics and have lots of autonomy over what they discuss and how they discuss it. For those folks that can't get out to a group, or perhaps there isn't a group in their area, we also have an online community with our Live Yes Arthritis Network, and you can go to arthritis.org again, and you can click on our online community and find a discussion. Those discussions are typically broken up by disease types, so osteoarthritis, rheumatoid arthritis, juvenile arthritis, and other topics. We also host a series of hot topics each week that include what we call subject matter experts. And this week, our hot topic is the opioid dilemma, and this is a significant issue for healthcare providers and for patients that have to make choices about medication. And what you're able to do is email in questions or your perspective on that topic, and you will get a response not just from peers, but our subject matter experts or healthcare providers that are moderating that week's topics. Other hot topics also included medical marijuana and CBD, which is a very hot topic in the arthritis community as well. So it's definitely worth checking out just for those hot topics and getting the takes from those experts in the field when it comes to arthritis resources. We also have a great tool for physical activity called Your Exercise Solution. You can go to Your Exercise Solution, Y-E-S, get it, yourexercisesolution.org. This is a mobile-friendly website, and you can do it on your desktop or, again, your tablet, your phone. And what's really cool is you see this little stick figure person on the left. You can indicate what joints are affected and then your physical activity level, and then it will share with you about 26 different physical fitness activities, everything from swimming, jogging, tennis, golf, and it will share with you adaptations that you can make based on your joint pain. So if you have pain in your wrist but you love to golf, it will show you different ways of gripping the club. If you have pain in your hips but you love to swim, it will show you different strokes that will cause less pain in your hips. So this was developed with the Arthritis Foundation and physical therapists and other healthcare providers. There's about 4,000 variations based on how you answer the question, so you can get a very personalized assessment of the type of physical activity that you can enjoy. And then we've got our Arthritis Today magazine, which comes out 5 times a year. It's got lots of great information about arthritis. And we also have our Your Coverage and Care Toolkit. This toolkit is really important for people when they are determining what type of health insurance to have. That includes Medicare and Medicaid. So choosing your coverage, learning more about the type of coverage that you have, and then if you have to deal with denials and appeals, we have template letters and specific information about how to access your care. And then again, paying for care. Paying for care is a huge issue. So whether it's copay cards or appealing a payment, or it's about using a third-party financial assistance program, a pharmaceutical assistance program, lots of great information, tons of resources in this toolkit to check out. And we also have that Better Living Toolkit that I mentioned at the top of my presentation. And this toolkit is great for understanding your type of arthritis, tracking your symptoms, setting goals, and how to share those goals with your healthcare provider. And we're running out of time, but our last thing is Walk with Ease. Walk with Ease is a walking program, an evidence-based walking program. You can do it on your own or with a group. You can definitely check out our website for this 6-week walking program, Walk with Ease. So I do want to leave some time for questions.
Yes, absolutely. Thank you so much, Nick. I apologize. I think I took a little too much time. I stole some of your thunder. But up here they also have a great arthritis resource finder, which is on their website where you can go to find some of these Walk with These programs and medical professionals that specialize in arthritis. And then we do have a nice slide here that recaps their all of their resources, and then we have some additional resources here. I encourage you to download the slides if you haven't already so that you have those resources at hand. And with the few minutes we have left remaining, I'll turn it back over to Steve for a couple questions.
Okay, sounds good. Thank you very much, Lakeland and Nick. And it's time for the Q&A portion, everybody. Let's jump right into it here. The first question, presenters, what can providers and caregivers do to help patients with arthritis stay safe in their homes and community?
So I think Lakeland did a really nice job of talking about staying physically active, keeping the home safe, using those adaptive tools. That can be really helpful. One thing I would add, if you really need assessment with figuring out what types of activities or what types of equipment would be helpful, I encourage getting a occupational therapy assessment. So you can typically visit an occupational therapy center, and they will have a lab where they have lots of equipment, and they'll test you for the types of activities that you can and can't do. They'll typically walk you through your day. How do you get up out of bed? How do you use the restroom? How do you get dressed? And they'll be able to share different tips and tricks, and in some cases equipment that can get that done. And also you can have that assessment done in the home, again, if that's really important, again, also for fall prevention. So it's definitely an option. It's definitely something to consider when working with your the folks that you give care to.
Okay, thank you. Next question. What are the best ways for weight loss if you're limited by pain in your joints?
It's great. Great. So I think the first thing is that we need to consider diet and portion control. That's definitely probably one of the most important things when you thinking about losing weight. And then physical activity. I think everyone thinks that physical activity has to be, run a marathon, or heavy weightlifting, and really don't think about that. Think of just range of motion exercises or very gentle exercises. I often tell people, your exercise program week 1 is walk around your room. Week 2 is just walk around the house. Week 3 is walk to the mailbox. Week 4 is walk to the end of the street. Week 5 is around the block. Don't start walking around the block week 1 if you haven't done it yet. Start slow. And people say, well, that's so easy. I can do that. And I say, exactly. You want to be successful. You want to be able to do it. So start really slow. Set some small goals. Get there gently. And then you're going to be there for the long term. You're not going to hurt yourself. And the other thing I would also add is it's always really important, if you haven't exercised in a long time, consult a healthcare professional like your general practitioner or even a physical therapist. Go to a physical therapist to say, it's been a long time. I've got a lot of pain. Help me develop a plan that I can do at home. Not necessarily something you have to go multiple appointments at the PT clinic, but they'd be happy to set you up with a plan for success that is based on your mobility and your pain level.
All right. Nick, can you remind us again the website for Your Exercise Solutions?
That's right. It's yourexercisesolution.org.
All right. Thank you. Next question. Can you apply a low-carb diet to limit inflammation of arthritis? How would you go about doing this with an older adult?
Well, you can definitely apply a low-carb diet. I think it's debatable whether it would affect your inflammation. I I defer to a dietitian or nutritionist when it comes to specifics about diet, but there wouldn't be any reason, a general reason maybe not to consider it.
All right. Well, unfortunately, we've reached the end of our hour here, and we're just about out of time. But Nick and Lakeland, I want to thank you for joining us for today's presentation. Thank you so much.
Thank you. Have a great day, everyone.
My pleasure. Thanks for having us.